welcome to today's episode of Baseball Throwing Injury Prevention. A couple weeks ago we interviewed an orthopedic surgeon to discuss this. Today I have two gentlemen with me that have worked with athletes of all levels and baseball in particular for many years, and we're going to discuss not only injury prevention tips from throwing mechanics and pitching mechanics to also performance-based information for you. So I have with me today Bill Welle of XPE Sports and Bill Schopp, who has been working with a lot of pitchers. And I'm going to kind of go with Bill Schopp first as far as giving us a lot of the information that we need to help prevent some of these injuries that we're seeing in baseball and throwing. So first tell us a little bit about yourself, Bill, and we'll go from there.
Fortunately enough, I had a chance to play Major League Baseball with the St. Louis Cardinals. I grew up, of course, so you can tell by the gray on the top of my hair, it was a long time ago. So the education level and the understanding that we had back then compared to what I understand now, I wished I would have known back then what I know now. I've been fortunate enough to work with Jack Nicklaus Children's Hospital with the orthopedic group. And because of my biomechanical background, the orthopedic group has used me as a post-injury fitness and throwing program. So I've had the opportunity to evaluate kids with elbow injuries and shoulder injuries. And I've had Tommy John and labrum tears. And I've been able to see the reference to what are they doing that's causing those type of injuries. And most of us understand overuse. The very first group of kids that they sent me from Miami Children's, I can't use any specific names of teams now, but there was a team out of Tamiami Park, and they won a national championship. It was a 14U team. Well, I went back and I talked to each one of the players and I said, how did this happen? They go, well, we've been training for 3 months. We won the Tamiami tournament, we went to Atlanta, we went to Chicago, and we went to California all one summer, and they never stopped throwing a baseball for 3 months. One game, they'd be catching, and the next game they'd be pitching. So, they were throwing thousands and thousands of baseballs per week. Well, growth plate fractures and stuff, when a son or a boy is going through puberty and that body is expanding, it's real easy to put an excessive stress on that connective tissue because of also the immaturity of the body. So overuse was probably most of it, and also conditional throwing habits from, let's say, a first baseman. A first baseman gets in the habit of not using his bottom half, which Bill will talk to you about fitness and lower half movement and footwork control and stuff is so important with us as baseball players, because if our body doesn't put our arm in the right position, our arm is going to have excessive stress, which was what happens. So I want to make sure these guys don't let me talk too long, but what I was able to see is third basemen, shortstops, second basemen, and first basemen have conditional movements that they use for those positions. But when you measure, I took a PhD course in biomechanics. I'm not a PhD, but I took a certification course, and it taught me about connective tissue stress levels. Well, when you're on flat ground or on the mound or on the infield or and the outfield, the connective tissue stress was only 2. So basically, you can get by with some techniques in the infield that when you go to the mound, the stress load goes to 6. So all of a sudden, it's a lot harder to throw the way you throw on the mound as it is in the infield. So I've had to work with those kids, and then there's also timing sequences. What we've learned in the courses that I've taken is most energy comes from hip separation, which is what Bill is key on with speed training and rotational skills. And the doctor's real good at looking at things that, hey, what can we do to fix them so that we can get him back on the field and work on the areas. So 58% of your energy comes out of hip separation to foot strike. And then the rest comes out of hip rotation and then also torso rotation. So the arm's the last thing that releases. Well, in most cases, coaches aren't at that level to where they understand those sequences, so they put their kids in. So 95% of arm injuries come from premature torso rotation, meaning the rotation is the torso's early and the arm's behind. and it puts a lot of stress on the elbow and the shoulder.
No, that's part of what I think a lot of people don't understand, is that a lot of this power generation from the upper extremities coming from the lower body, and how can we take that into consideration during our training and our rehab to make sure that's happening? Because sometimes what I see in the clinic is they may be coming off an injury, and it could actually be a lower extremity injury, totally unrelated to maybe throwing, but maybe they sprained their ankle or they hurt their knee or there's a low back issue.
It hurts their momentum.
Exactly. So then they rehab it enough, but they never really bridge that gap from, okay, now my knee or my ankle or my back is fine, but do they ever bridge that gap to now performance, to where they're able to get that 58% of the rotation and power, what we call the kinematic sequence, where your power starts from the lower extremity and it transfers up all the way out to the hand and into the ball. And unfortunately, if you're not getting it starting from here, or there's maybe a weak link that's a problem there, that's going to you're going to, in your head almost, it's going to make you use too much of the upper extremity and not enough of the lower body, and you really end up with decreased velocity. So obviously a performance aspect, but then also injury prevention. And so that's one of the key takeaways I want you to have today, is that the lower body is instrumental in your throwing velocity, performance, and injury prevention. And so that's where Bill Welle is going to take over and discuss some of the things that a baseball thrower, pitcher, can do in the gym, in a training facility, to try to help with the injury prevention aspect. And again, obviously performance as well. So
I think one of the things that needs to segue from that is, I'll use the example of a suspension bridge. You know, you've got push down holding you up. And when we talk about a baseball player, a lot of other sports, but especially on that baseball side, your decelerator muscles are the things that have to support you. So even developing that power and push off the foot, you also have to have something that's going to decelerate you. Even as we get that power and push, something has to stop us. And that's where you get that rotation and turn. Well, if we don't, one of the things that we try to work on is, how do we develop that power and push initially? If we're trying to work on power and push, to your point, if you went short, now something has to happen in order to compensate. And 9 times out of 10, it's going to come from shoulder elbow, right? So as we get that, and that power and push comes from here versus turn and hip, well, what happens on those decelerators? Now they've got an added power deceleration. So those are the kind of things that we try to address and try to push. When we talk about push from that lower extremity, not only do you have to have power and push, you have to be able to stabilize it. And so when we do a lot of single leg stability stuff to work on proprioception, we work on not full squats, but more of a body weight, or understanding how to move the body initially and graduate. Going into the gym and just going to do squats is are you putting yourself up for possible injury? Yes. Because if you can't squat correctly, if the knees start going over the toes and we start generating power, now we've got too much force going through the patellar tendon. Yeah. Now we're setting ourselves up for failure right away. So trying to get it where we get more strength and stabilization, but doing it in proper technique. So that's the first thing we teach, is technique and form, and then build from that to do more strength training, more power development. Well, what does that mean? When we're working on strength, we're working on understanding where the body's at, and now trying to push through, whether it be a squat. We'll do split squat. Again, watching the knee, making sure you're going straight up, straight down. We'll do a foot on a box, so you're doing a single leg, and really working on that. But also, again, back to that proprioception, understanding where are you at right now. If I do a single leg, anything, if I do a single leg row, I'm working on that stabilization of that leg. Well, it's so important for those pitchers to, if I can't stabilize myself, again, to your point of an injury that happened, my proprioception, I may take off a little sooner than I want to. If I can't stabilize myself, get that push, or is it going to come from? So you kind of got to take a look at, have you been injured? Have you had something in the past that needs to be addressed? Have you worked on technique and form to begin with, and then gradually building from that?
I really like your discussion with stabilization. One of the analogies I've used in the past was it's like if you had a cannon trying to shoot off of a raft, right?
Right.
It's not a stable platform, so you're not going to get the same effect of the cannon per se. And so if you try to develop power without developing stabilization, that power is not going to be as effective, and it's going to be uncontrolled and lead to injury instead of actually preventing injury and obviously improving performance. And that's one of the things I've noticed just my years working with you guys with NFL combine training and developing speed at the highest level for football players. You know, there's a lot of stabilization going on with those guys too, not just pure speed and pure agility. And it seems to be very similar with a baseball thrower in the sense that if you can develop their power and stabilization in the lower body, which is what you're doing with your athletes, you're going to improve the whole pitching mechanics and all the results that you want to get from it, right?
Correct. Absolutely. Absolutely.
Great, great. What would be one piece of it? I'm going to ask one question of each, just a quick hitter here. What would be one that we didn't discuss already, piece of advice you'd give a parent that has a child that is throwing, even if it's a teenage and even up to a college level, to help prevent injury? What would be one tip that you could provide them?
Monitor the number of throws per day, per activity, and try to track it per week. And especially a younger kid going through puberty and stuff, he needs rest. He needs days off. You cannot throw a baseball 7 days a week. But let's just say they're on an aggressive competitive travel team, and the demand is all the time. Well, I mean, let's say if I had a pitcher that threw on a Thursday, and then Friday we had a practice, and he was also our first baseman, I would let him still play first base, but I'd also put a bucket behind him, so when he received all the balls from the infield, he just threw the balls in the bucket. So, and if he was a pitcher outfielder, he could still grab the fly balls, but I would also let somebody else throw the balls in. So, this part of the body, it does need a rest.
That makes a lot of sense. One of the things I think people forget about is your son might be a pitcher, but he probably is another position player, especially going through the youth ranks, and those are throws as well. So that adds up for sure. So, how about yourself? What would be one tip that you would give from a performance standpoint for injury prevention?
I think one of the biggest things is to work on those decelerator muscles. So to work on the subscapularis, to work on trying to get those shoulder blades together. And you don't need a lot of equipment. You don't need any equipment. You can do it laying down and work on a series of drills to work on pulling those shoulders back. We were talking the other day about the scap opening up too much and not being able to stabilize. Well, there's some things just here to here, thumbs up, different angles, just to work on, here to pull that back and work on that stabilization.
That's perfect. And that's one of the things we talk about, the shoulder having 3 lines of defense essentially. And the first line of defense is the shoulder blade or the scapular stabilizers, and that really helps set the whole thing into a good stable platform. And then number 2, your second line of defense is your rotator cuff, and that's kind of your dynamic stability of the shoulder joint. And then 3 are the passive ligaments, like your labrum and your capsule. You hear a lot about the labrum, and that's kind of the third line of defense. And unfortunately, a lot of our shoulder injuries occur because the first 2 lines of defense are subpar, and they're not doing enough to really make that strong. And so what we find a lot after someone finally gets the surgery is they do such a good job of rehabbing that they're actually come back stronger because they rehab the heck out of the scapular stabilizers and the rotator cuff, and obviously now the labrum was surgically repaired and they're doing really well. But if you actually had the mindset of doing prehab and doing all that stuff ahead of time, with guys like you would get that first line of defense and second line of defense optimally firing, and you're obviously your lower body so that you're getting the whole kinematic sequence going, and you'd be amazed at your performance levels increasing and your injury prevention. So I really appreciate your time today and your expertise.
Thank you.
If you have any questions, just feel free to leave a comment or contact us. We're at XPE Sports here. Again, this is Bill Welle and Bill Schopp. So thank you very much.
Thank you.
Definitely.
Appreciate it. Yep.